your head on.
Oh, I'm gonna just scratch this just to make sure you're nice and numb, first of all. Nice and numb, right?
Oh,
stop it! We're on camera.
Oh, sorry. Pardon me. Yes, I feel nothing.
Okay, good. Make sure you never feel anything sharp or uncomfortable, okay? We're gonna kind of squeeze you here, so make sure you can breathe, okay? Like breathing through your mouth, and if you can't breathe through your nose, okay? And make sure nothing's sharp or uncomfortable. We're taking our first layer here in Mohs surgery. Hopefully it's our last. You're nothing sharp, right?
Nope.
Okay, good. Doing just great.
So what is this Mohs?
This is a special technique that we take as little view as possible because we actually could check the tissue while you wait. So I'm going to take off what we see here, and then we're going to check it. We'll be able to check the tissue. Actually, right next door, we have Rachel who's processing the tissue, and she's going to be able to check it. I mean, she's going to put it on a microscope, on a slide, so that I can look at it under the microscope.
Okay.
And then we'll be able to see all the edges and down deep to see whether it's clear skin cancer or not.
So previous procedures, you just take.
You just take a margin around it, and you're kind of guessing. You know, you take like a standard 3 to 5 millimeters around it, which is pretty big. And you only have so much nose.
That's true.
You have a cute little button nose. We want to keep it that way.
Thank you for saying so. Okay, I feel a little bit of a pain.
Oh, okay. We're done then. We're done now. So that's good. She's gonna put a bandage on you. Let me process, or let me prepare this tissue here. Right here.
There's part of that tissue that's tickling my eye.
Okay. Something's tickling his eye.
She's tickling my eye.
I was?
Oh, her.
Oh, okay.
I forget. Tell me again.
Maybe it's Valerie or Betty. One of these girls. She's just a girl. Hey, girl.
Hey, girl.
Yeah. Okay. We're gonna process this tissue. I'm just gonna lay it out so that she can lay it out nice and flat. And then we have his nose. And it's like this. Blue, red, green, and green. So the R is where I put red nicks, and the green is where I put green nicks, and that's how I know when I look at it under the microscope what the orientation is. I'm gonna take a little bit more on one edge here, so I'm gonna make sure we have a little more numbing on you first.
We're getting the stab with the needle.
We do. It's not your last either today.
What?
You got a few others, because we're gonna probably put some stitches here and fix you up.
Oh, sweet. I love stitches.
You do. Good. I'm gonna take that bandage off of you. Red blood there on the inside. Good. Okay, she's stretching that area, and so I know it's on this top edge, so I'm going to take a little more from here. Make sure nothing's sharp, okay? Nothing sharp or uncomfortable. Good. Give you a little buzz here again. I know, we have a lot of them. I don't know what was in the water, but I know we actually have one that had her baby, and she's coming back very soon.
Awesome.
Coming back as a couple of them are, well, one is going out. Then we'll have one pregnancies for a while. here we have our skin cancer removed completely, right? You're acting here. Yeah, let's try a fun one. This is the kind I like to do on the nose, that is. It's pretty small. He's got a good nose to work with, except that it's not very movable, actually. Your nose is not very wobbly. Some people's are more wobbly than others. Did anyone ever insult you like that before?
No, it's that Viking in me.
So we're gonna try to hide this in your normal creases in your nose. Like here's your nasal crease here. We're gonna use a 4 and 6. We're gonna actually move this tissue, taking a little bit of tissue right here, and then also probably making an incision right along your nasal crease to be able to pull this tissue closer. You have a mole or a keratosis next to it. I'm gonna take that off too. We'll take that off. So since we're moving this tissue, this is where there's more movement. This way, I have to take into account that fact, and we're gonna need to take a little bit of extra right here to be able to move this over here. Like that. So this is gonna move like this, as such. We're gonna move this over here. So we actually are gonna move a little bit onto your cheek here, because we're gonna try to shift this tissue a little bit more close.
Sounds fun.
See it straight on and see, yeah. Your nasal sidewall's good for that, okay?